It brings tears to my eyes now, even now talking about it. This is how bad it was.
How important is it for that kind of prayer to take place?
Really important. This might be the last time they're able to speak.
I just sat on a chair and just held his hand to be with him in that time.
It's hard to comprehend how historic these times are when you're living them. It's distance that relayed clarity. The lives and jobs lost because of coronavirus are destined to become chapter headings, not footnotes, in the public record. And in one corner of the East End, the work of a tiny morgue will become part of London's narrative. All communities here have been hit by the coronavirus, but this place, up and running in a matter of days, serves the desperate burial needs of the Asian community, pummeled the most by the disease. Some of the victims come from the nearby Royal London Hospital, having prayed much of their lives in the East London Mosque.
At the height, we were dealing with around 25 bodies daily coming into the morgue because the cemeteries and other funeral services weren't able to cope.
The leadership of the East London Mosque felt it had a duty to intervene when Muslim dead began to pile up.
It's beyond really comprehension. People would have this guilt inside the family and the community that we couldn't do the right thing for our deceased, especially the ones that suddenly passed away. So it would have been a guilt that would have been felt throughout our lives. This lady phoned us up in East London Mosque and said, well, look, I've got my dad who died, passed away in the hospital. My mum is quarantined in my home. I can't see her because I have to be away from her, and I can't see my dad before he is buried. This is the kind of situation that we had. And it brings tears to my eyes now, even now talking about it. This is how bad it was. People felt so helpless.
It's often when we feel helpless that some turn to faith. While the Royal London may be one of the leading teaching hospitals in the world, there's always a little corner for what's important. The Muslim chaplain here, Imam Farouk Siddiqui, is proud of the Royal London's links to one of the biggest Muslim communities in Britain. He's on his way to see a patient who survived COVID-19, but whose underlying health conditions were complicated by the disease. She doesn't have much time, and she's refused any medical intervention at the end to save her life. A balm for the dying. Farouk's had to recite these words so many times in this pandemic. Farouk, just how important is it for that kind of prayer to take place?
It's really important for not just the patient, but her children and the kind of extended family. It's a kind of source of comfort for them to know that they've had a chaplain, a religious figure, come say some prayers for comfort. And this might be the last time they're able to speak and say the most important words in our faith, which is La ilaha illallah Muhammad Rasulullah, that there is no God but God.
Meanwhile, death appears 2 floors above on the coronavirus wards. It's been a difficult night for the team here. They lost 4 patients, every one a tragedy, and at the height of the pandemic, on one night 11 people died. Now this is one of the vacant, empty beds left behind. The day before, we spoke with senior sister Becky Smith about the possibility one of her patients was nearing the end.
Potentially we'll make a decision about whether it's appropriate to continue with what we're doing at the moment or whether we should give him a bit of dignity.
He wasn't getting any better, and overnight his life-saving drugs were stopped. A white partition was placed around his bed, and Becky's face was the last one he saw.
Take us into the cubicle at that moment.
I just sat on a chair and just held his hand to be with him in that time. It was a very quick experience in that way. We give the patient a full wash together, so 2 nurses will always give them a warm wash, put them in some new clothes so that they can be sent away with a lot of dignity and respect.
Do you take any of this home?
I think in these current times with COVID, it's a lot harder to separate things because you feel like it could be your dad, it could be your mum, because it's so close to home for everybody in the world at the moment. It's difficult because it's happening every day. So you do definitely take it home.
We'd all like to leave behind more than an empty bed. For the shadow we cast to be benign. Those who chronicle this time of coronavirus will record that this hospital and the community it served tried to work together to leave a legacy of which both could be proud.